Hey guys, Scott here with Surf & Shore. Today we're going to go through some knee extension. So, big thing is we can't get the knee all the way straight and staying nice and bent. We need to get it pushed all the way down. Having the knee bent is going to affect our functioning hugely. One of those big negative things that we really want to avoid, whether that's post-injury or post-surgery. Post-surgical, it definitely takes a lot of time to get back. Should be back within about the first month or so though. That should be the priority. Priority after any surgery should be knee extension and quad activation. That should be phase one, no matter what the surgery is, trying to get it working, okay? So, changes a little bit if you post-op ACL versus non-ACL, maybe it's just meniscus or something like that. The push changes a little bit, and the things we can do can change a little bit. But this is just going to go through nice general ways to really get everything straight. So I'm going to take both knees. We're trying to kind of surround the joint. I don't want to go all the way above, all the way below. We're really trying to kind of get on the joint. Heel's going to go out. We're really trying to push down perpendicular to where our leg is at. So I don't necessarily want to push straight down towards the ground. I want to try and get that angle where I'm coming up and across. So you need to, if you have a problem getting there, get a little further lean over. That'll help you get that force going a little bit more down to try and help get the knee straight. Just nice little pushes, just kind of giving a little bit of a bounce to it, as opposed to just constant pressure. If you want to hang out there and just do constant pressure, you can. I found that the knee typically responds a little bit better if we give a little bounce. Kind of takes that pressure off. It kind of allows the muscles to relax a little bit, guard a little bit less, so we're not just trying to get those muscles tight and fighting our way through. So just nice and easy, pushing it down. Anywhere from about 2 to 5 minutes. You can do, if you need to take a little break, bend it a little bit, it's going to be okay. Any bending after we do straightening is going to be a little bit tough, so don't be surprised if it's a little bit more stiff as you're bending up after you've done a bunch of the straightening exercises. From here, next thing we're going to do to follow that up, now that we have a little bit of new motion, we're going to go into the band. Band is going to go up right behind the knee. We're going to get a nice amount of pressure coming through here, and then we're just going to straighten out, really trying to use that quad to fire. All the way straight, control it all the way on the way back. I don't want it to be this jerky motion. Everything should be nice, smooth, controlled. We're not using the hips to go back to straighten out the knee. We're trying to keep hips, shoulders nice and upright, and we're really just using that quad to try and get everything straight. If you need to use a little bit of rotation or a little bit of a hip, at first you can, but really try and focus on just getting the quad firing up, down, get that quad fired up. With that one, you want to do about 2 sets of 10, somewhere there. So you're really just trying to reinforce and get that knee extension back to normal and try and get that muscle functioning within that new extension range to keep the motion that we just got. Try that one out if you have any knee extension problems. It's going to be a great way to get it moving again, get you functioning back to where you want to be.